Imagine feeling constantly fatigued, bruising easily, and getting sick all the time. What if I told you it could all be connected to a condition that affects every type of blood cell in your body? Sometimes low energy, um, it could be symptoms of serious blood condition. In this video, we'll dive into pancytopenia, a hidden condition that could be the reason behind your health problems. Last week itself, I had two patients, incidentally, who had pancytopenia. One, it seems like I understand what's going on. Other one, we are doing the workup with hematologist. So let's delve into pancytopenia. What is pancytopenia? What causes it? What can be done to find out what's the reason and the treatment available? So pancytopenia is a condition in which all three major blood cell types are decreased: red blood cells, white blood cells, platelets. Red blood cells carry oxygen, so you feel fatigue, weak, shortness of breath. White blood cells, they fight infection. So when it becomes low, you have recurrent infection. Platelets, they help clotting, they help stop bleeding. So lack of it causes easy bruising and bleeding. It's not a disease itself, but it's the lab finding that signals underlying problem. How does pancytopenia happen? There are three major mechanisms. The most common is bone marrow production problem. Number two is peripheral destruction or sequestration, where the production is normal but is getting eaten by something in your body, and most likely could be big spleen. Third thing could be dilutional or combined causes. So I'm going to break them down very clearly. Bone marrow failure or suppression. Number one cause, aplastic anemia. There's immune destruction of marrow stem cells. Can be idiopathic, drug-induced, viral. Leukemia or myelodysplastic syndrome, which is malignant infiltration of bone marrow, crowds out normal bone blood production. Drug or chemotherapy induced, different chemotherapy, certain antibiotics, certain anti-epileptic medication, also methotrexate. Infection, HIV, hepatitis virus, parvovirus, B19, and severe sepsis. Then nutritional deficiency, B12 or folate deficiency. They are reversible, and they cause metablastic changes, megaloblastic changes in the cells. Hypersplenism, sequestration. Enlarged spleen traps blood cells of all types. It's common in cirrhosis, portal hypertension, lymphoma, or some metabolic genetic disorder. Autoimmune disorder, lupus, rheumatoid arthritis, like a Felty syndrome, bone marrow infiltration because of metastatic cancer, lymphoma, tuberculosis, rarely though. How do we work it up? We confirm with CBC, low hemoglobin, low hematocrit, low WBC, low platelets, check for MCV, for size of red blood cells, and retic count to see if there is enough production going on or not. Then we check peripheral blood smear to see if there's a blast cells. Blast cells usually indicate leukemia. We look for hypersegmented neutrophils that usually indicate B12 deficiency. And then we look for broken red blood cells called schistocytes that usually indicates destruction of red blood cells. So then we have basic lab, B12, folic acid, iron studies, liver function, viral panel for HIV, hepatitis, LDH, which indicates destruction, haptoglobin, which also indicates destruction of red blood cells. Now, bone marrow biopsy, if the diagnosis is unclear or in this case, we usually is done by hematologist. If there is a persistent pancytopenia, the suspicion of malignancy, or if there's a severe cytopenia. Red flag syndrome is when there's a fever with low blood cell count, that's medical emergency. There's active bleeding, severe fatigue, weight loss, or night sweats. Treatment of cytopenia depends on the cause. Nutritional deficiency, replace B12 folic acid. Improvement will be happening within weeks. Infection, treat underlying infection, supportive care. Aplastic anemia, usually immunosuppressive therapy, ATG and cyclosporine. Sometimes even bone marrow transplant is curative in eligible patient. For leukemia and myelodysplastic syndrome, we need chemotherapy, targeted therapy, and a stem cell transplant. For hypersplenism, if cirrhosis, portal hypertension, cirrhosis needs to be fixed, and most of cirrhosis cannot be fixed until they have a liver transplant, particularly in advanced cases. Supportive care, RBC transfusion, platelet transfusion, and growth factors. Can pancytopenia be prevented? It depends on the cause. If because of nutritional deficiency, it can be prevented. If because of toxic medication, that can be changed. We can have vaccination against hepatitis, early detection of liver disease, and monitoring chemotherapy closely. So macrocytosis, pancytopenia, think of B12. If massive splenomegaly, think hypersplenism and the cause of hypersplenism. Blast on a smear, urgent hematology referral, that indicates leukemia. Young patient and hypocellular marrow, that indicates aplastic anemia. Now, two of my patients, one patient came with a white count of 1.6 thousand, platelet count of 67,000, and he had history of chronic alcoholism. He drinks about 8 drinks every day. I've been doing it for many years. So I'm seeing him second time, and so I'm doing the workup on him. And of course, I had a discussion about cessation of alcohol. He is not willing to, but it's early in the treatment plan right now. So hopefully, we'll find out definite reason, and then talk to him again and get something out of him, so that he can help himself. Other person is 85-year-old male who was not feeling well, and he is pancytopenic. His platelet count is 24,000. There's no spontaneous bleeding. He's feeling okay, just he's feeling tired. He got hematology appointment next week, and so he's gonna have workup. Important thing is that pancytopenia leads to low RBC, low WBC platelets. Bone marrow failure, nutritional deficiency, hypersplenism, malignancy, infection. These are the 5 most common causes, and they cover 99%. So we're going to find out the underlying cause and treat patient. Thank you for watching. I'm Dr. PK from Dr. PK Life.